Good afternoon. First of all, I'd like to thank the organisers for inviting me today. It's a real privilege to be here and hopefully contribute to what is a very important debate going on over the next couple of days. I'm just going to share with you a few thoughts on my experience and the IFC's experience of public-private partnerships in healthcare, give you a little bit of a flavour for some of the driving forces behind some of these partnerships, and also some of the learnings perhaps that we're seeing arising from these partnerships. So along with some of what I've already heard this morning, we see some of the drivers for these types of partnerships being the increasing financial burden on governments in providing healthcare services to its population. We're seeing, as others have already said, this shift from communicable to NCDs. We're seeing increased expectations from the growing middle classes in many emerging markets for better healthcare and more efficient healthcare. And we're seeing certainly a shortage of both infrastructure as well as skills and capacity within the public sector. And there are some interesting estimates that are really quite frightening when you look at some of the numbers. There's at least one report that says that between 2010 and 2020, the OECD governments and the BRIC governments alone will spend something like $68 trillion on healthcare. I can't even imagine how big that number is, but it's clearly a huge number. And I think governments are beginning to realize that to be able to sustain the type of healthcare systems that they want to develop and grow, they need to change the way they operate. And they need to bring in more private sector investment, more private sector know-how. And in that sense, PPPs are certainly something that we're seeing more and more as something that governments are looking to solve some of those problems. Like all of these things, PPPs should not be seen as a panacea to all problems. It is, they are one tool in a toolbox that governments can use and shouldn't be, as I say, the only tool. So just in terms of how PPPs have evolved, I guess the true birthplace of PPPs was probably the UK back in the mid-1990s for healthcare. So the UK government introduced the Private Finance Initiative, which was really focused on building new healthcare infrastructure, so hospitals. And through that programme, England and specifically England has, I think, built around 100 new hospitals through that programme. But actually, as time has moved on, so have the models themselves. And now we're seeing a much varied group of projects being classed as PPPs or public-private partnerships. And so at the one end, we have the traditional infrastructure project that I've talked about, and at the other end, we're now beginning to see some governments both considering and in some cases introducing what we're calling the integrated model, and that's already been alluded to this morning by other speakers. And what that integrated model does is to take, in some cases, take a given population area, so for a district or a region, and allowing the private sector to provide the full range of services from infrastructure to clinical services, from primary care to secondary and tertiary care for that population. And then we see a variety of different payment mechanisms being used to finance those projects. So again, at one end of the spectrum, we see the capitation models that, again, were alluded to this morning, and there are some examples of that have worked very well. And in some other cases, we see a very much simpler, perhaps less sustainable in the long term, fee-for-service type models being introduced. And actually, in between those two extremes of models, we're seeing very narrow, focused PPPs to deliver things like dialysis services or diagnostic services or something very specific that is much more service-focused rather than asset or infrastructure-focused. And people ask me all the time, in terms of my work and my team's work, we work in pretty much all over the world, but our focus is very much on emerging economies and very much on providing better access and better quality of healthcare to the poor in particular, given our aim as a development institution. And people ask me constantly, what is it about PPPs that make them successful? What works, what doesn't work? And there are many lessons that you can take from projects, but again, just have to realize that Every project is slightly different, and certainly our advice is that you don't take something from Africa and drop it into India and make it work without adjusting it to your specific needs. But there are some lessons that come out of these projects, and so I'll just touch on a few of those themes. And again, some of these have been touched on in other debates this morning, so I won't dwell too much on them. But I would say one of the key success factors that you need is strong political will. You need to have conviction behind the PPP policy. You need to have politicians championing the projects at a practical level and at a implementation level, not just at a policy level, because I think that generates the ability for both the public sector to deliver on implementation, but also attracts interest from the private sector in terms of seeing the seriousness of the politicians in delivering these types of projects. And again, you need to have the right regulatory environment for PPPs. That requires the ability to enter into long-term contracts of this nature. It requires there to be the right regulatory framework in place to make sure that the private sector is delivering on its contractual obligations, and it requires a degree of know-how and learning to be applied across the public sector as a whole, not just project by project, but on a much larger scale. Again, one of the things that I would say that is specific to healthcare that perhaps you don't see in other sectors when you're looking at PPPs is that you need to make sure that your PPP project, when you're doing one, is integral to the overall health system. So some of the things that I've seen in other parts of the world that have perhaps not worked so well is where a PPP project is seen as in isolation from the rest of the healthcare system, and that creates its own problems that can create sustainability issues further down the road. So always look at that project as part of the overall healthcare delivery system, and always think about how that project can affect the other parts of the healthcare system as well. Risk sharing is something that we hear a lot about in terms of PPPs, and quite rightly, PPPs can be if well structured, can be a good way of sharing of risk between the public and private sector. But of course, on the one hand, the public sector has to realise that risks are not a free good. So every time you transfer a risk to the private sector, there is a potential cost associated with that risk, and you need to think carefully about whether it makes either economic sense or commercial sense in transferring that particular risk to that private sector operator. Equally, from the private sector side, there needs to be recognition that when you're delivering a PPP project with strong government commitment behind it, you're not necessarily being exposed to the risks that you might be in your traditional operating environment, and therefore you need to think about how your returns, in terms of your investment returns, are commensurate with the risk that you're taking in that project. And last point on that is that, in some extent, the clue is in the title. It's called a public-private partnership. And the key point here is partnership. And quite often, what I see in projects that are struggling or not working as well as they might is that there is that lack of partnership, either because there is a trust deficit between the public and private sectors, or in many cases because the public sector in particular doesn't have the capacity to manage that ongoing project in the longer term. So again, look at these things as a partnership and as a long-term partnership, and invest your capacity and resources to that end as well. And just to finish off before we hand over to the rest of the panel, just a little bit about why IFC are involved in these types of projects. Clearly, as a development institution, what we focus on is improving economic conditions for the poor and emerging countries. So my team, for instance, works on around 18 projects in healthcare at the moment around the world, and most of that is focused on either India or indeed Africa. So that's where we spend most of our time advising governments, and we specifically advise governments in this space, not the private sector. We also play a role in capacity building, so we mobilize both the wider World Bank resources, or indeed in some cases donor resources, to help governments build capacity in this area of PPPs to allow them to structure projects well and to monitor projects in the longer term. And finally, I think one of the key roles that we're beginning to play now, that to a much greater extent than perhaps we did in the past, is that we are beginning to evaluate operational projects and really starting to learn from what's working and what's not working in these types of projects. And I think over certainly the next couple of years, we'll see much more evidence start to emerge from those evaluations. So in fact, in the next month or so, we're kicking off an evaluation of 3 healthcare PPP projects, one in Mexico, one in Brazil, and actually one in India. And I see that very much a part of our contribution to the debate is presenting that evidence, disseminating the evidence, and making sure that there is an informed debate about the strengths and the weaknesses of PPPs as a model. Thank you very much.